As a healthcare psychologist and EMDR therapist, I have been working with EMDR for almost a decade now, and I still think that it is one of the most incredible and effective therapies that exists. Today, I want to discuss with you 6 of the most frequently asked questions about EMDR. If you are new here, subscribe to my channel and turn on the notification bell so you don't miss new videos on psychoeducation, mental health issues, and psychological empowerment. EMDR is a psychotherapy that enables people to heal from the symptoms and emotional distress that are the result of disturbing life experiences. This therapy does not require talking in detail about the distressing issue. You don't need to complete homework between the sessions as well. EMDR therapy allows the brain to resume its natural healing process. In general, EMDR is a short-term therapy. It can be completed in fewer sessions than other psychotherapies. You can watch my previous video if you want to know more about EMDR and in particular about how EMDR works and what you should expect. An average EMDR session is about 60 to 90 minutes, but you are probably curious about how many sessions it will take. Many people seem to believe that EMDR can treat trauma in a few short sessions. Is it true? Well, to some extent. Each person treated with EMDR is unique. Like I already said, EMDR therapy requires fewer sessions than traditional therapy. But it's not possible to know in advance the precise length of treatment. Treatment can be very rapid. Relief from emotional distress can be reached within first few sessions. But the number of sessions depends upon the nature of the problem and the complexity of the issues being dealt with. If there is more than one trauma to process, or it's about a long-term trauma, like in case of a complex post-traumatic stress disorder, the therapy can take a longer period of time, months or even years. It also depends on whether EMDR is being used as a stand-alone treatment or as a part of another therapy. Besides, there are individual attributes and private circumstances which have a strong influence on one's recovery speed. For example, the presence of social support, the degree of motivation, the ability to manage negative emotions, eventual drug or alcohol abuse, and so on. EMDR therapy has many applications, but the most documented is trauma. However, EMDR is much more than just a therapy for PTSD. There has been a lot of research on EMDR therapy, so that is now recognized as an effective form of treatment for trauma and other disturbing experiences by organizations such as the American Psychiatric Association and the World Health Organization. EMDR has the ability to heal people who are suffering from all types of trauma. Anyone who has ever experienced an upset that they have not recovered from can benefit from EMDR. It can also be used very effectively with depression, anxiety, grief, phobias, dependence, stage fright, public speaking, pain in general, and more. The fields of psychology and neuroscience research are fast changing now. The more we learn, the more we discover new applications for EMDR therapy. You can see more and more books and tutorials appear about self-administered EMDR in the last few years. If you ask me personally, I would answer that I am very cautious of recommending to apply EMDR on your own. And I will explain why. EMDR therapy is a mental health intervention, so it should only be offered by properly trained and licensed mental health clinicians. Moving your eyes back and forth seems simple, but EMDR is not a trick, it's a complex technique. The process of reprocessing of traumatic experiences can be challenging even for the experienced therapist. If a trauma is treated incorrectly, a person can develop psychological complaints such as depression or anger. Sometimes I meet patients in my practice whose EMDR has gone wrong. Traumas are often intertwisted. Among the many memories a client has, you have to address the right one. As a therapist, you have to know what you are doing. So the statement, if it doesn't help, it doesn't harm, is not appropriate in this case, in my opinion. Would you want to receive a treatment by someone who does not understand how it works? Obtaining the full benefits of EMDR requires being able to talk with a therapist to process the memories and resolve them. A professional can help you to face memories that you may be tempted to avoid. In addition, trauma processing is an in-depth process. If we are overwhelmed or upset, we are not able to take a necessary distance from our emotions. The result is that we can get stuck in strong emotions. We need somebody from a distance to guide you through an emotional roller coaster. You can see a therapist as a navigation through tough memories. For this reason, I would not even perform EMDR on myself if I needed to, but I would ask a colleague. That's why it's also not a good idea for us therapists to perform any therapy with our family or friends. Another reason I don't recommend using EMDR on your own is that because of persisting controversies regarding the safety and potential efficacy of self-administered EMDR therapy. Only the limited evidence available suggests that self-administered EMDR for PTSD may be safe and efficacious, so more robust scientific research is needed. Part of the EMDR process is actually to learn techniques for easing anxiety that you can do outside of session. It's possible to learn how to cope with the anxiety and distress that comes up from experiencing a traumatic memory. These are methods you can learn from your therapist or may be found online. But if you're still willing to try do-it-yourself EMDR, I would suggest try it only when you don't have profound mental complaints and if you don't suffer from any big traumas. Try it only if you want just to process a difficult day, an embarrassing event, or when you have made a wrong decision that keeps coming back in your thoughts and evoking emotional reactions. Usually EMDR is done face-to-face in your therapist's office. Corona pandemic has moved much therapy online. Since a year, I give a lot of EMDR online and I can say from my own experience, yes, EMDR can be definitely done online or virtually. The feedback that I have received from my patients has been mainly positive. EMDR online is relatively new and it's important to note that the research is ongoing. The research of online therapy in general has been studied and found to be highly effective. As always, there are advantages and disadvantages of each form of therapy. The advantage is that you don't need to travel to your therapist's office. If your session is done, you can benefit from the comfort and safety of your own home. You can jump at your couch, under the blanket, with a cup of tea or take a nap. Online therapy allows you to choose any therapist, even thousands of miles away. You just need to have a device for a video call, a decent internet connection, and a quiet room. However, there are some considerations for online therapy. First of all, you need to have a space where you can speak uninterrupted and where you can feel safe and comfortable. It may happen that connection cuts out, so it's very important that your therapist can reconnect with you either by video chat or a phone. In this case, or in case of dissociation, your therapist needs to be able to call you emergency contact. If it turns out that you suffer from severe complaints, having suicidal thoughts, hurt yourself, or dealing with multiple mental issues like PTSD and personality disorder or addiction, then online EMDR may not be a good choice for you. Let me know in the comments what you think about EMDR. Have you experienced it yourself or maybe somebody in your environment? I will try to answer as many as possible of your comments and questions below this video and on my Instagram page. If you enjoyed this video, give it a thumbs up. Don't forget to subscribe and turn on the notification bell so you don't miss any of my content. See you next time.